Hello everyone, welcome to sqadia.com, and in the second section of our lecture topic we will talk about the examination of the patient. In the examination we will talk about the general and systemic examination, breast and abdominal examination, and pelvic examination of the patient. So in the breast examination, usually it's an important part of the examination. It's always preferred to teach the patient how to do the self-breast exam so they can perform the breast examination at home also. And usually the breast examination should not be performed just before the menstrual cycle. It should be done after the menstruation. And the steps of self-breast examination is usually, it is divided into 5-6 steps. In the first step, it is better to tell the patient that they should do the examination by just looking in the mirror first. Stand and look in the mirror by observation with both arms on the side. So by keeping both arms on the side, stand straight and just look in the mirror. Just by looking in the mirror, patient can observe few things. If there is any change in the size of the two breasts, if there is any scar, any dimpling, any discoloration in the breast, that can be observed just by looking in the mirror. Then in the next step, ask the patient to raise the arms above, and then just by looking in the mirror. If by elevation, if there is any change in the size, if there is any appearance of any swelling, any dimpling, that can be noticed. Then third, they ask the patient to put the arm on the side and then do the same. Observe in the mirror. And then here, just by the side, if the patient is doing the self-examination, it's preferred that they should, if they are examining the right breast with the arm on the side or on the here, or keeping the arm straight, use the left hand to examine the right side. Similarly, vice versa. So self-examination is, if patient is palpating the left side, use the right hand. Tip of the fingers is usually used for the palpation. And if somebody else in the doctor's office, it's easy. When you are positioning or when the patient is positioning, doctor can do the palpation. But in the self-examination, if patient is palpating the right side of the breast, use the left tip of the left hand of the fingers. So here, this is palpation. Inside the axilla, it's important to feel the lymph nodes in the axilla. Axillary lymph nodes are involved if there is any inflammation, infection of the breast tissue. Lymph nodes in the axilla are involved very commonly. So first, by keeping the arms on the side, look in the mirror. Then elevation of the arm, look in the mirror. Then by keeping the hand on the side, look in the mirror. Then repeat these steps by elevating the arm. Look in the mirror. Then by keeping the arms on the side, repeat the look in the mirror. And then laying down is important. Usually when palpation, when laying down, put the pillow below the side you are examining, and that helps to elevate the breast tissue, and if there are any masses or swellings, that can be more prominent. The other important way to tell the patient that while they are in the shower, they should do the breast self-examination, because it helps to feel it better when they are in the shower. So these are all the steps. by observation, by elevation the hand, by putting the arms on the side, and by laying down, usually by putting the pillow under the side of the which is examined. So like this. Always use the tip of the fingers to examine, and always you go clockwise like this and start from inside, go outside, and as you keep on going, go and feel the lymph nodes in the axilla or armpit also. Then these are the diagrams again, which shows you this is the Sims position. Sims position is very commonly used for a pelvic exam or rectal exam. In this, the patient is on the side with left leg straight and right leg bending on the knee. And then this is the lithotomy position, another position used to examine the pelvis. Here, patient is on the back with feet in the stirrups. And this is another position with patient on the back with knees bending. This is the position usually used for bimanual examination. Pelvic examination using the two fingers and then pressing the abdomen before bimanual examination. In the abdominal examination, some points to look. Usually there is pulsation, shape of the abdomen, which is scaphoid or if it's distended, if there are any dilated veins, if there are any stretch marks are common after pregnancies. If there is any hernia is the protrusion of the organ through inguinal hernia. Here is very common inguinal hernia, and in the abdomen usually umbilical hernia is very common, which is through the umbilical opening. So umbilical hernia is the protrusion of the organs through the opening in the wall. So umbilical hernia, and if there is any peristalsis or movement of the intestine, look for the position of the umbilicus, if it's inward or it's everted or it's pointing outward. For examination, usually 5 points are used, which is inspection, palpation, percussion, auscultation. So these are few steps of examination of the patient. Inspection is by looking, palpation is by feeling, percussion is by producing the sound, and auscultation is by listening through the stethoscope. So first it was examination. This was the inspection. On inspection, we saw the positioning of the abdomen. If there are any pulsation, what's the position of the umbilicus? If there is any hernia, if there is any prominent peristalsis, and all that. Then in the palpation is feeling the organs by using the fingertips. So that's the palpation. In palpation here, this is the liver below the ribs on the left side, then spleen on the right side. That's the large intestine, and then that's the small intestine. So on the palpation, few things we can notice is organomegaly. Organomegaly is enlargement of the organs. If liver is enlarged and it's coming down by palpation, we can feel the edge of the liver. That's easily palpable. If it's enlarged due to hepatitis or due to some cirrhosis, that liver can be felt very easily by palpation. On the palpation, we can also feel if there is tenderness, means when we press, patient feels the pain or not, or if the tenderness is rebound tenderness. Rebound tenderness, when we press on the area and leave it, patient feels the sharp pain. Rebound tenderness is very common sign of appendicitis. When patient comes with inflamed appendix and we press on the side and leave it, patient feels the tenderness. That's called the rebound tenderness here. If there is any rigidity, rigid means if the abdomen felt very stiff, not soft, that's the rigidity. Rigidity and guarding is common in the inflammation like peritonitis. Usually there is guarding and rigidity. So all these are very common signs that can be felt on the palpation. And remember, first step was inspection. When we examine the abdomen, what are different changes in the abdomen. Second step is palpation, in which we use the tip of the fingers to palpate the different organs in the abdomen, and if there is any enlargement of the organ, if there is tenderness, any rigidity, we can tell that on palpation. Then the third step of examination is percussion. Percussion is the feeling or producing the sound using the fingers. This is the step of percussion. You put the hand on the body and then using the middle finger here, you tap. This is the percussion. We put the hand and then this is the percussion. Different underneath structures. If air is present, it produces resonant sound. If fluid is present, it produces very dull sound. If some enlarged organ is present, is again produce dull sound. So it gives the idea what's inside. So here, finger. They put the hand on the body and using the middle finger tap and then listen to the sound produced. Enlargement of liver span is measured by the percussion. Other thing that can be auscultated or listened or diagnosed using percussion is any air in the chest, pneumothorax, if there is any fluid in the abdomen, which is ascites. So the liver span is estimated by percussion. Remember that it is easiest to hear the change from resonant to dullness. So proceed with percussion from areas of resonance to the area of dullness. Resonance, as I told you, chest, which has air, lungs has air in it. So air inside the lungs produce resonant sound. So when we move from resonant, which produce loud sound, to the area of dullness, we can feel that change. So this arrow, we are coming from resonant to dull area. Chest is resonant and abdomen, liver is dull. So then upper border in the mid-clavicular line, start percussing in the chest, moving down towards the abdomen, about 1 centimeter at a time. Note where the percussion note change from resonant to dull. So again, once we move from resonant to dull area, that gives us the idea if liver is enlarged, and if we feel it below here in the right hypochondrium, little low, it means the liver is enlarged. So again, here, resonant sound, more resonant. When it's dull, we don't feel louder sound, then it's area of the dullness. So percussion is listening to the sound produced when we percuss on the chest and abdomen. Then again, percussion, these are all the things you can percuss. If coils of intestine, usually they have air, they produce resonance. Tumor produce dull sounds. If there is fluid, it's tympanic sound, or more like not resonant, dull sound is produced. Again, tumor produce sound, fluid produce sound. Now the third step is the auscultation. Auscultation is the part of the examination in which we use the stethoscope and listen to different sounds of the body. Auscultation is done mainly to listen to the chest, to listen the heart, if there are any heart murmurs, if there are any rhonchi, rales, wheezing in the chest, that can also be auscultated. But in the abdomen also, the most common sounds which are auscultated is the sounds of the peristaltic waves. It's the movement of the intestine. You hear the peristaltic waves. After any surgery done on the abdomen, usually after 48 hours, the best indication if patient is recovering or if the patient can have something to eat is the appearance of the percussion, peristaltic sounds. And you put the stethoscope on the abdomen, and if the peristaltic sounds are there, it means the patient have the intestines start to move, and now they can have something to eat. So that's the very important use of auscultation on the abdomen. Also, you can also hear the arterial bruise sound on the abdomen and the venous hum. All these are the sound produced by the flow of blood through the veins and the arteries. And these are the peristaltic waves. Then in the pelvic examination, we do the inspection of the external genitalia. Just first step, when the patient position in the lithotomy position with the feet in the stirrups, just observe and examine the external genitalia. Look for any lesions, any swellings, any fissures. All these can be examined in the external genitalia. Then the vaginal examination is the second step. Rectal examination is also can be performed by proctoscope, rectoscope, and then by the finger also rectal examination can be done. In the vaginal examination, usually the examination of cervical and vaginal walls is done, and then palpitation of the cervix and vagina by digital examination. Usually 2 fingers are used, or 1 finger is used to examine or to feel deep, to find out the position of the cervix or all the structures around. You use the 2 fingers. And then bimanual examination is also used, in which one hand is on the abdomen and then one is used to palpate the or feel the pelvic organs. This is the vaginal examination, vaginal speculum. The best way to insert the vaginal speculum is first lubricate the vaginal speculum and insert it sideways. Always go sideways. Once you enter, then you turn it and bring it and then open it. So always go sideways, then twist inside the vagina and then slowly open it. This can avoid any pain or any injury. So good lubrication is also helpful for easy insertion of the vaginal speculum. So open the area and then lubricate the vaginal speculum, go sideways, enter, and then turn it down and open the vaginal speculum. This is the digital examination, positioning of the fingers for bimanual examination. Here you use this bimanual position for the digital pelvic exam. Here, if you see, this is recto-abdominal. One hand is on the abdomen, the other one finger is in the rectum. Rectum is at the posterior end, just close to the sacrum. Here, this is the sacrum, lower end of the vertebral column, and close to that is the rectum. So one finger inside the rectum, and then one hand on the abdomen. This is the examination of the rectum. Then recto-vaginal with the two fingers like this. One finger goes in the rectum, one in the vagina, and then one hand pushes on the abdomen to bring the organs little down, so any abnormalities, any swellings, any masses can be easily palpated. Then again, this is the identification of uterine tumor in bimanual examination. Here, if there is any uterine tumor, feeling of the uterine tumor. Again, identification of ovarian tumor. This is the positioning for uterine tumor and for ovarian tumor. Bimanual exam. Positioning of the hand on the abdomen is different. Here you feel the pushing of the whole uterus and just pushing of the front part, lower part. So this can bring the ovaries little in front. And then adnexal mass, any growth on the side, this can also be palpated by the bimanual examination. So that was all about the systemic and general examination and breast examination and pelvic examination of the patient. Thank you for watching sqadia.com.